wellness. And in 2001, when I founded In Results Health and Wellness, I kind of was conflicted on how I can help cancer survivors. I'll tell you my own story real quick because it's compelling, and there's a reason why we offer free personal training and education to cancer survivors. In 1987, about a year after I graduated from college, my father was diagnosed with prostate cancer, a very aggressive prostate cancer, and in 6 months he passed away. That 6 months was a journey of watching a very healthy man, a man who was a world-class sprinter in college, a person who raised three, I would say, excellent sports boys. He taught all my brothers and myself how to throw a football, how to catch a baseball. And to watch him go from a healthy, what I thought at that time was a healthy individual, to succumb to the complications of prostate cancer was something that you never forget. In 1991, my mother was diagnosed with thyroid cancer, and then in 1992, she was diagnosed with esophageal cancer. She survived both of them today, and I think, knock on wood, she's cancer-free. In the same year, my sister-in-law, my youngest brother's wife, was diagnosed with double breast cancer, cancer in both breasts. And she, at that time, I think my older nephew was about 5 years old, and my younger nephew was about 3 years old. And she was given 6 months to live. And I remember one evening I was spending the night over at their house, and I heard her pray. I heard her say, "God, please, just let me live long enough to see my sons graduate high school." You know, and I thought to myself, you know, what can I do personally to help my sister-in-law survive this? You know, if only for her two sons. And then I thought, I said, you know, my background is exercise and nutrition. And I said, what better medicine is there for the human body but exercise and good nutrition? You know, a lot of people don't think about exercise and nutrition as medicine, but it's how your body helps to fight disease. There's a lot of ways it does it. It does it with the lymphatic system, but there's also good medicine out there. But exercise and good nutrition also is a way to help your body not only fight disease, but it helps to prevent disease as well. So I said to myself, if anything, I can encourage her to start exercising. So I sat down with her and I said, you know, I understand that you're going through a lot of things right now, but we should just go for a walk. And she said, no, you know, I probably should rest and save my energy to fight this cancer. I said, well, I understand rest, but I also understand exercise. You know, look at me. You know, I'm a Greek god. But no, seriously. And I said, well, you know, let's just, if anything, it's going to take your mind off of what you're going through. So we kind of walked down the block one day, and I said, you know, you need to just kind of walk down the block and come back and stuff. And then next weekend I'd go out and we'd walk a couple more blocks. Pretty soon I had her jogging. And then after that I had her doing weight training. This was all as she was going through chemotherapy and radiation. And she said, you know, I didn't start sleeping better until I started walking and doing resistance training. I didn't start having improved appetite until I started exercising. And if anything, while I'm exercising, my mind is someplace else. I think I'm able to run a marathon. I said, hold up, right now it's not a time to run a marathon. But keep doing what you're doing. This is 2013 and 1992. She was diagnosed with breast cancer, given 6 months to live. And to this day, she survives breast cancer. And far as I know, I saw her about 2 months ago, she's cancer-free. So I know that exercise and good nutrition is a way of battling not only cancer, but think about a lot of diseases out there. What about heart disease, diabetes, Alzheimer's, mental illness? Exercise and nutrition is such an important part of everybody, and it should be an important part of everybody's lifestyle and regimen. So what Dominic and I are going to do tonight is we'd like for everybody to participate. We're going to lead you in a couple exercises, okay? If you're not, if you're not comfortable about doing them, that's okay. You can sit and watch. But if you are, and there's some exercises that you might not be able to do, our job is to teach you how to modify, okay? So our slogan is, don't give up. Don't say you can't do it. Learn how to say, I can modify this exercise so that it feels good to me and it helps me improve my life. Okay? So what we're going to do, I want to grab the stretch tubing and the balls, is we're gonna lay out a diagram around the room. We're going to demonstrate the exercises to you, and then we want everybody to get up, and we're going to start exercising. Now, we're going to do it. There's a lot of people here tonight, and we'll probably have to do it in two. So we have 12 stations. We'll start off with 2 people in each station, and then we can just rotate, okay? So we'll start off. Okay, can everybody hear me? All right. Who said I wish he'd shut up? No. I'm joking. That's part of my personality. What can I say? Okay.
We like to have fun.
Yeah, we do. This exercise should be fun. It shouldn't be something that oh my God, I got to go exercise. You should be like, man, I'm ready to exercise. Let's get this going. Okay. Dom, can you demonstrate for me, please?
Sure.
Okay. So first thing we're going to do is called scapular retraction. All right, and we're going to use stretch tubing. We have thick stretch tubing for those of you who are really strong, and then we have the red one is for people who have a lot of strength. Green one is for people who have very little strength. And remember, our motto is try the exercise. If it doesn't feel good to you, we'll learn how to modify it. Okay, so first one is to work your scapulas. This is going to help strengthen what we call your posture muscles. We're working the rhomboid, and there's a lot of group of muscles in this area called the subscapular region, okay? Yeah, a lot of muscles there. And what he's doing right now is as he pulls the stretch tubing, he's contracting his back muscles, okay? So as you do this exercise, you should feel the contraction in your back muscles. Now turn towards the front. Now look what happens. For those of you who may have had some type of surgery, whether it was a mastectomy or reconstruction, look how it opens up the chest to allow more flexibility in the pectoral region. So very good exercise if you've had any type of construction or surgery in the pectoral region.
So on this tubing, the shorter that you grab, the harder the resistance. So if it's too hard, just grab out a little wider. The main focus point is squeezing your shoulder blades back together. It is on. It's on. It's not. It's flipped on. So yeah. You just squeeze.
You got a loud voice. You can hear
I know.
him
Well,
much
he wants
better.
it for the. There we go. All right. That was you.
Call him on it, Dom.
I know.
All right. So next one we're going to do is we're going to do what's called a push-up with a crossover, okay? So I'll show you a lot of different variations to this particular exercise. So if you do a standard push-up, oops. I don't know why it went too loud. Okay, so if you do a standard push-up, we know that a standard push-up is like this. What I want you to do is practice crossing over, if you can. Now, if you can't, we're going to do a modified push-up. That's okay if you can't cross over, that's fine. If not, this is a modified on your knees. So it's just a fun way to add variation to an exercise. Again, we're working on the pectoral muscles to help strengthen the pectoral muscles. Okay, the next one is called a modified dynamic lunge. Dynamic simply means movement, okay? So on this one, I just want you to practice jumping, bend your knees a little, like this. That's a lunge. If you can't do that, simply shuffle your feet, okay? Lateral movement squats. If you've ever done a squat before, you know that you want to rotate your hips back. But with this one, you're not going to leave your feet. You're just simply going to do this. You can also do this to help increase your range of motion if you've had any surgery that involved the lymphatic system. You want to demonstrate the wall push-ups? You guys got me breathing hard already. And I do this every day. Okay. Again, if you're not able to do the push-ups from there, this is another modification for push-ups. It's called a wall push-up. Now, if you want to have fun, you can rotate like this. Okay? So that's for those of you who like to have fun. If you don't like to have fun, but that's okay too. But don't call me when it's time for you to do something. No, I'm joking. I'm joking. I'm teasing. Arm curls?
Yep. Okay, so with the arm curl, easiest resistance would be to step on it with 1 foot. You want to lock your elbows right to your side, arms straight down. You always want to start any of these exercises with good posture. So standing up tall, shoulder blades back. So right here, then you're going to come all the way up, keeping your elbows pinned right to your side. So all the way down, all the way up. Okay, so you're going to exhale, breathe out on the way up, all the way down. To make it a little more challenging, 2 feet on the tube and up. And as Curtis says, to make it more fun, spread your feet out. So it's just shortening the length of the rubber band, the tubing. Okay. There you go.
Okay, standing ab crunches. All right. This is a good exercise for those of you who may not be able to get down on the ground, but it's very important to strengthen your abs, okay? You've got a lot of group of muscles in the abdominal region. We call this the core of your body. This is where strength actually starts, okay? It always starts from the center of your body. So what we're going to do is called a standing crunch. So, and this also works on balance too. So if you're having any challenges with balance, this is going to help your balance. Always draw your abs in. Suck your abs in, keep your abs braced. I'm not a big fan of interlacing your fingers. I like to keep my fingers on the side of my head so I don't pull my neck. There's a couple of times I've actually lost my head by pulling on it. So don't lose your head tonight, okay? And just simply go like this and contract your abs, okay? All right? Romanian deadlift.
2 leg? 2 leg or 1 leg?
1 leg for stabilization and balance.
Okay, so we're going to do what's called the RDL, Romanian deadlift, on a single leg. And then we'll go through a variation if you can't do it on a single leg. So you want a slight bend in your knee, straight back. You're just going to reach down. So you reach down as far as you feel comfortable. And you want to keep your back straight. So if you can reach all the way to the floor, go ahead. 2 feet if that's too much. Same thing, you're keeping your legs, you don't want them locked. You want what we call a soft knee. And then just bend at the hip.
Not on camera.
Almost like you're going down, you know, to touch your toes. Again, this exercise you build up to doing weight. So what you always want to make sure is when you're performing this exercise, keeping your back as flat, straight as possible. You don't want to round like this. You want to keep it flat like so. Okay.
So actually, in the interest of time, I'm gonna ask whoever wants to do this exercise. We're gonna show you how to do a couple of them from standing in just by standing in front of your chair. Okay. So if whoever wants to do them, go ahead and stand up. Dominic and I will demonstrate some more exercises for you. Okay. So whoever wants to do these, and we'll start with. We'll start with a modified scapular retraction without the tubing, okay? So what I want you to do is I want you to hold your hands up like this. Okay, everybody do that. All right, now, remember what I want is contraction in your back. So I want you to bring your hands together like this, and as you come back, squeeze your back muscles nice and tight, okay? Come here. And then squeeze back, okay? So let's do 20 of them together. On the heart, the one thing that people have a question about is how do you breathe when you exercise, okay? So the rule of thumb is on the hardest part of the exercise, you exhale. So think about the hardest part of the exercise, which is the contraction, is when you exhale. So guess what the easiest part of the exercise is? The easy part is getting started. No, it's bring your hands together, okay? So bring your hands together, take a deep breath. Now exhale, let's do 20. Good, that's 1. Inhale, exhale. 2, really squeeze those back muscles tight. 3, very good. 4, excellent. 5, good. Inhale, exhale. Now is everybody tightening their abs? Draw your abs in, keep your abs nice and tight. I can only count to 10. I haven't learned how to
11.
count past that. All right, who's all
12.
counting? Very good. Draw your abs
13.
in. Inhale, exhale.
14, big squeeze.
Very good.
15,
Nice.
16,
Good.
17,
Excellent.
18,
Very good.
19,
One more.
20.
All right, now let's get into our squats. So what we're going to do is just lean to one side, raise your arm here, and lean to the other one. All right? What's the hardest part of the exercise? It's staying awake.
Starting. Staying awake.
That's the easiest part.
Yeah,
That's
easy.
it. Raise up. Good. So if
Yeah.
you've had any surgeries underneath the armpit, this is a good way to increase your range of motion. Working the quads, the hamstrings, and the glutes. Keeping your abs tight. Make sure you're breathing. If anybody passes out because you're not breathing, we're going to revive you with the fire extinguisher. We're not going to do CPR. Very good. And right there. Good. Okay. Let's work a little bit more on stabilization and hamstrings and glutes by doing a Romanian deadlift. Dominic's going to...
So again, if you want to do it, start off with 2 feet. Then if you want to challenge yourself a little bit, then we can go to one leg. So we'll go 2 feet, slight bend. Just reach down and back up. Okay. Slight bend in the knee, back flat, down. Good. Again, the hardest part of the exercise is when you're going to exhale. You're always going to go down. You're not always going to come up. So that'd be the hardest part. Exhale on the way up. So breathe. Keep your core tight as you go down and squeeze your stomach muscles as you come back up too. Let's go 5 more. 1, 2, breathe. 3, 4. When you come up, all the way up tall.
Very good.
5.
Excellent.
Good. Awesome.
Let's get into our standing crunches, okay? So, hands behind your head. Remember, don't interlace your fingers. I don't want anybody losing their head tonight, okay? Try to flatten your elbows like that. Again, what we're trying to do is open up your chest, not literally, okay? Ready? Draw your abs in and go. 1, 2. Exhale as you crunch. 3, 4. We'll try 15 of these. 5, maybe 16. 6, 7. Inhale. Now exhale. 8. Keep your abs tight. 9, 10. Okay, 6 more. 11. And crunch. 12. Good, strong abs. 13, 14. And one more. And 16. Very good. Okay, one last exercise, and we'll let you rest, okay? We're going to do an exercise called a Russian twist, okay? So that kind of sounds like a drink, right? So one night I was having vodka, and I said to my friend, I go, how great would this taste if we put a lime in it? And he said, what, a Russian twist? I go, no, a Russian twist is like this. I'm talking about vodka and lime, all right? So let's do a Russian twist. Again, we want to draw your abs in, keep your abs nice and tight. I want you to bend your knees slightly. I want you to have your body as upright as possible. Sometimes I use the word erect, but then all the guys laugh. So I never say erect, okay? I say keep your body nice and strong. And twist. Keep your abs nice and tight. We're working the inner obliques as well as the rectus abdominis, the transverse abdominis. And keep your abs nice and
Keep
tight.
them tight. Make your stomach.
Draw your abs in.
Yeah, move.
Very good. Keep breathing. Can you get the fire extinguisher ready for me, please? All right, and a few more. And that's it. Okay, let's take a couple deep breaths. Inhale. Let's go 2 more. This puts us in recovery. And 1 more. All right, very good. You all did excellent. You did really well. Thank you so much.
Dr. Asher's interest is in clinical practice as well as research, working with cancer patients in their rehabilitation, post-treatment, and during their treatment. He has a special interest in the physical and rehabilitative needs of survivors and how survivors continue to experience the side effects from their treatment many years after finishing. And with a focus on the non-pharmacological management of pain, cancer-related fatigue, neuropathy, and working with patients to help manage some of their weakness or muscular skeletal problems that Curtis and Dominic talked about. He is a graduate of Claremont McKenna College and also of the University of Rochester School of Medicine. He also practiced internship in internal medicine at the University of Pittsburgh and did his residency, rehabilitation residency at UCLA Greater Los Angeles VA Hospital. And he also did a fellowship at MD Anderson. So I could say a lot more, but I'd like to introduce Dr. Asher.
Hi, everybody. So I imagine there are a few patients here, at least, that travel up to Cedars-Sinai. And I really first want to acknowledge you all because I had no idea how hard it is to get from here to there. And after fighting the 5 o'clock traffic here, I do empathize with you all. So you all exercised right now. And I think my talk could be short and sweet and be done in 30 seconds if I just told you exercise is good, try to get some, and I could sit down. But the reality is I don't think that usually works because it's much easier to tell people to do something than to hopefully explain why we want to be doing it. And as soon as this screen comes up, we'll get started and talk about why I think exercise is important for people going through treatment and when you're done with treatment and you're in the recovery phase. So while we're waiting for the screen to pop up, I'm going to go ahead and start. The first couple of points is actually intended for the caregivers in the room. And I imagine there are a few people in here who don't have cancer or have never had cancer. And I think it's hardest for the caregivers to understand how significant fatigue can be and how deeply it can affect your quality of life. So I'm going to start by reading 2 short quotes. These are real quotes from real patients to kind of give a glimpse of the kind of fatigue that people can experience from cancer and cancer treatment. So here's what one of my patients said. I feel anger at the loss of energy. I used to hop on my bike, think about studying for a doctorate, but all that gets disrupted. Everything is disrupted. I get mad because I never knew I would have to learn to live with this. Here's what a second patient said. I couldn't overcome it. I couldn't force myself. The fatigue was overwhelming. There would be times when you might be tired, but you can make yourself do it anyway. I couldn't make myself do things anyway during certain phases of it. So it was just overwhelming. It kind of took over my life. Obviously, these are some of the more extreme cases of fatigue, and there is a big spectrum. But I think the goal of the next 40 minutes or so is to give you an idea of what causes fatigue in the cancer setting and some concrete strategies to try to handle this problem. So should I just continue without? I could just talk for a little while until we get images going. So let me give you a few background points on fatigue. Number 1, it is extremely common. I'm willing to bet that at least 95% of patients at some point during cancer treatment, whether it's chemo or radiation, or whether it's hormonal treatments after breast cancer or prostate cancer, experience fatigue. So it's ubiquitous. The more advanced the cancer may be, the more chemo, the more radiation you may be receiving, the more significant it may be. So it is quite variable, but the point is it is extremely common. And I think one of the challenges with fatigue is it's not talked about much. And correct me if I'm wrong, but I imagine that when most patients see their oncologists, the last thing they want to do is complain about something as mundane as being tired. And this is the person that may have saved your life, or you feel indebted to them, or you feel like there's nothing you can do about the fatigue. So it's something that's not talked about much when we see our physicians, and therefore it's not really managed or treated as a result of that. And I think that's one of the things that we're really trying to change, because we know, based on study after study among cancer survivors, that this is the most distressing symptom among cancer survivors in general. This is another point intended for the caregivers in the room, because it's hard to understand what cancer fatigue feels like if you've never had cancer. So there's healthy fatigue. This is the fatigue that we all have experienced before cancer. So if I stay up all night studying for a midterm, or if I'm out at a party late at night or a wedding, and I only get 4 or 5 hours of sleep, the next day I wake up at 6 a.m. because I have to go to work, and guess what? I'm tired. But if I take a nap or get some extra rest that day or sleep earlier that night, the fatigue goes away. That's so-called healthy fatigue. Cancer fatigue is a whole different beast. This is defined really as a persistent sense of fatigue. So the key point with the definition is it does not go away with a full night's rest. You can get 8 hours of sleep, and wake up in the morning and feel exhausted. That's a classic example of cancer fatigue. Or you'll hear things like, all I did was a load of dishes or some laundry or some light cooking, something I did all the time, and I was wiped out, I was exhausted. That's cancer fatigue. People that have never had cancer honestly don't get that. And it's hard for them to get that because they've never experienced the type of fatigue that one goes through under cancer treatment. So I'm going to spend a little bit talking about what causes cancer-related fatigue. Obviously, the first bubble up there is the chemo itself, the radiation, perhaps the cancer itself. All these things can cause fatigue. It turns out that there may be a genetic vulnerability to developing fatigue after cancer. And we're actually doing one of these studies in conjunction with UCLA to look at certain genetic mutations that may make some patients more susceptible to this problem. For patients with breast cancer or prostate cancer or ovarian cancers or others who go through sudden hormonal changes can experience fatigue as a result of this. And we have to think about broad things. So if somebody has heart disease or lung disease or kidney disease or thyroid problems, all of these things can cause fatigue too. And in our clinics, we usually always, of course, screen for these problems that may be sometimes reversible. Physical pain. And there's a number of reasons why people going through cancer treatment may have physical pain, whether it's from hot flashes or surgery or pain from the mastectomy and axillary dissections, and we can go on and on. But being in pain can cause fatigue, or being overly medicated from pain medications can cause fatigue. So it's a tricky balance sometimes. Medication side effects. Excuse me. So medication side effects. Any of the nausea medications sometimes that are used can cause fatigue. Steroids that are used to treat inflammation or a part of cancer treatments can cause fatigue. Sleeping medicines can cause fatigue. So some of the medications that are given to help support people through cancer, that can be the culprit as well. We're going to talk about sleep at the end if there's time, but I'm going to venture and say that 50% of the people in this room have a hard time sleeping at night, have a hard time falling asleep or staying asleep at some point during their treatment, or if not right now. And I can tell you, it's very difficult to have energy during the day when you're experiencing poor sleep at night. And if there's time, we'll talk about strategies for this. Depression and anxiety, it's obviously a huge impact that it can play on fatigue level. And it's easy to understand why we can be experiencing these types of symptoms as we're going through this whole journey. Chronic stress, chronic isolation, it's a similar mechanism. Poor nutrition, and oftentimes when patients are going through chemo, they crave certain foods, and it's understandable, and they may not be the most optimal foods to try to improve energy. And what we are really going to be focusing on today is how being inactive and how losing muscle mass can play a very important role in this fatigue process. And then I have one bubble in bright yellow, and that's a word you've never heard of before. And that's referred to as inflammatory cytokines. And more, we're learning that these chemicals that I'll talk about in a second seem to be the most important factor in causing cancer-related fatigue. So I think if we're going to try to manage this, it's worth spending a minute or two and understanding what are cytokines. And intuitively, everyone in this room has experienced inflammatory cytokines. So if I pause for a second and ask you if you've ever experienced the flu before cancer, I'm sure everyone in this room would nod their head and say, yes, we've experienced cancer. Not experienced cancer, experienced the flu. So during those 2, 3, or 4 days, when you're down with the flu, how do most people feel? Tired, extremely tired. Most people may feel a little blue or sad or depressed if you think about it, how you felt for those 3 or 4 days. Most people feel a little bit foggy. Nobody wants to open up a textbook and study for exam when you have the flu. So we're learning that it's not really the flu virus that makes you feel so tired. It's your body's immune system response to that flu. So your body gets that flu virus. It says, okay, there's some kind of foreign bug in me. I don't know what this is, but I'm going to produce these chemicals called cytokines that's going to make you feel crummy. So your body's intentionally making you feel tired, kind of sad and blue and depressed, maybe a little bit foggy. And of course, why would your body want to do that to you? To make you rest. It's your body's way of protecting you. It's your body's way of saying, you're going to stay home in your cave. You're not going to be chasing buffalo or gathering nuts and berries or chopping wood. You're going to stay home and rest until the flu is gone. And after a week or two, when the flu is gone, these chemicals subside, and guess what? Your fatigue level gets better, and your energy goes back to normal after a couple of weeks. The challenge in this arena, and this is a medical slide, but I hope it makes sense. The challenge in this arena is we're learning that when your body sees these cancer cells, or when it gets exposed to chemotherapy, which it views as a foreign bug, or radiation, which it also is like a foreign process to it, it responds to those foreign stimuli the same way as it would as if you have the flu. So what does it do? It produces these inflammatory cytokines. But this is not a 3-day or 4-day flu. Many people can be going through chemo for months and radiation for weeks. And so the fatigue can last much longer. Follow so far? So the trick is, and what we're going to need to have to focus on, what can we do to try to decrease these inflammatory cytokines? And we're learning that based on some of the genetic things that we've been talking about, some people, for whatever reason, may produce these cytokines for months, weeks, or sometimes years after they're done with their chemo or radiation or surgery. So for some survivors, and it's estimated from anywhere from about 20 to 30% or so, continue to have high fatigue levels even though they're all done. And I think that's the most important group that we have to try to help. And by the way, a lot of these things that we've been talking about, so losing muscle mass, or poor nutrition, or stress, or depression, or poor sleep, all of these things also produce inflammatory cytokines, which again makes the fatigue worse. So you can see you have a vicious cycle going pretty quickly. And this is basically what's happening on some level. And this is a very simple diagram, but I think it illustrates what we're seeing every day in our clinics, which is you have cancer, you're getting surgery, chemo, radiation, or some combination, and guess what? You're tired. And what does everyone do when we're tired? We like to do what we're doing when we have the flu. We want to lay around. It's the natural response to when you experience fatigue. So you're tired, then you're inactive. And then when you're inactive for a while, you become deconditioned. And if you become deconditioned for a while, then you become more tired. And then when you're more tired, you're less active. And you can see very quickly you have this negative loop that's taking place. And what we're trying to replace that with, and granted this is much easier said than done, is when our patients come in with cancer fatigue, rather than being inactive, to try to create a personalized, tailored exercise program for them. And with that, with time, hopefully that will improve their endurance, result in more energy, and then you'll be able to do a little bit more exercise, and then very quickly you're on this more positive feedback loop. So why this, and I think this is the key part, why is exercise helpful for cancer fatigue? Now we talked about why we think these inflammatory cytokines causes fatigue. And over the last few years, there's been a robust amount of evidence that's showing over and over again that exercise reduces inflammation. It is a very powerful anti-inflammatory medicine. And I should tell you, there are many, many pathways, and these are very complicated, many biological pathways that produce inflammation. So the idea of taking some medicine like Advil or some anti-inflammatory pill that they may even be working on in research labs to block inflammation is probably going to end up being too simplistic, because even if you block one pathway, the body has many other pathways to create inflammation. The beauty of exercise, and I'm not going to go through all the nuances of why it does this, is that it decreases inflammation on at least 8 different levels that we're aware of. So it blocks inflammation on multiple levels. I'm going to introduce 1 or 2 because I think it's easier to explain, and I think it's pretty telling. So one issue has to do with something we refer to as bad fat, visceral fat. And you've probably heard of this idea of having 2 body shapes, either being kind of having your fat as apple-shaped or being pear-shaped. You may have heard about this on the news, and we think that being apple-shaped is more harmful to us in general. Why is that? The reason has to do with this. We're learning that the fat that goes deep in our abdomen, so by our liver and our deep organs, that fat doesn't just sit there doing nothing. It's actually sitting there producing these inflammatory cytokines. That's why that type of fat is associated with higher risks of chronic illnesses like maybe heart disease or diabetes or other problems, because it's producing these inflammatory chemicals. So, and here's the list. So it's linked to heart disease, to diabetes, to cognitive issues, and it's even been linked to some cancers. And the most common ones that we associate with this are breast cancer and colon cancer. I should point out something else, and this is really important for our cancer patients and survivors. Even if your so-called body mass index, so that's like kind of your if you take your weight and your height and calculate your BMI, even if that's normal, you can still have this bad fat. So we have to figure out a way of combating this problem. And the bottom line is, I think the best way to get rid of bad fat, this visceral fat, is again, getting some moderate aerobic exercise. Even if you don't lose weight, and I want to emphasize that point, even if you do not lose weight, your body is reducing the amount of visceral fat. And that's important, and some of the stats are here. So even in the absence of body weight in both men and women, you can reduce visceral fat, and that reduces your inflammatory chemical load. This is, I think, is just a simple experiment, but I think it's very telling, and I think it will hit the point home. And I'll explain these images in a second. So this was a very simple study done in Denmark, I believe. And what they did was they took about 20 college kids who were active, and they put them in an MRI machine. That's an MRI of the abdomen, of the belly. And what they did before the study is they measured their bad fat, their visceral fat. And you can see before the study, this area in white, you all see that? And with the arrows, that's referring to the visceral fat, the bad fat. Then they had these 20 college kids. And by the way, these kids did not have cancer, did not have any health problems. They had them go just 2 weeks. So they had them go 14 days of being inactive. So they asked them to just lay around. They asked them to go from 10,000 steps a day, which is considered moderately active, to 1,500 or less per day. And after the 2 weeks, they put them back in the MRI machine, and you could see in just 2 weeks, the average visceral fat in the study increased by 7% in just 2 weeks in healthy college kids. And you can see it. You could see the difference. So you have to wonder, these studies haven't been done with people going through chemo, but you have to wonder if one is going through weeks or months of chemo or radiation and kind of laying around in bed because they're tired, what kind of changes are occurring in their body composition. The second way that I'm going to talk about, and I'm not going to go through all 8, I promise, of why exercise reduces inflammation. And this is an illustration of a muscle cell. And the point here is that we used to think that people like Curtis, who have lots of muscles, just do it to look good, right? and it was just a cosmetic thing, or it was a thing to keep yourself physically strong so you can lift heavy weights and lift heavy objects. But we're learning that when you have muscle, your muscle doesn't just sit there moving things. It actually produces chemicals. And this is, again, a fascinating area that's been looked at only over the last few years. So your muscles, when it's contracting, is producing, guess what? Anti-inflammatory chemicals. So it's another way that exercise reduces inflammation, because it's actually producing its own hormones. So I don't know what happened to the bottom half of the slide, but the point is the same. I don't have time to talk about all these things, but exercise is not only important for fatigue, but we're learning that it's probably the best medicine to ward off cognitive impairment and possibly Alzheimer's disease, more than playing Sudoku or crossword puzzles. There's no evidence that playing Sudoku can prevent Alzheimer's disease, but there is evidence that it can reduce your chance of Alzheimer's with exercise. Balance, and again, Curtis talked about this. When people have peripheral neuropathy from chemotherapy, your balance is affected. There's no good evidence that exercise reverses the neuropathy, but it can still improve your balance based on balance centers in the brain. And that's a way of coping and handling the neuropathy better. And then we won't have time to talk about this, but osteoporosis is a huge issue for many cancer survivors. And I know people tend to think about calcium and vitamin D, which is very important. Doctors talk about medications like whatever, Actonel, Fosamax, et cetera, which is important. But weight-bearing exercise is a critical part of fighting osteoporosis, and I don't think it gets enough emphasis. So we've been talking about up to this point about why exercise is important for making us, and I'll come back to the slide, so don't worry about the images, but why it's important for how you feel, for depression, for anxiety, for bones, for possibly helping people sleep better, which was what we'll talk about. But there's more and more evidence that it may actually help with survival. Okay, and we're going to talk about this in the next couple of minutes. So this was a study looking at brain tumor survivors. I don't know if there's anybody here who had a brain tumor, but what it's basically showing is, now METS refers to your fitness level. So the yellow basically means they were more fit, and the blue means they were less fit. And you could see after 25 or 30 months, there was a significant difference, not in just how people felt, but in their actual survival level, if they were more fit. And we'll see this over and over again. Breast cancer, that's probably what I imagine what many people in this room were treated for. There is a 50% reduction from the studies that are available to us in breast cancer-related death for people who get regular exercise. That's basically getting about 3 hours of walking per week. It didn't matter if you exercised your entire life or just started after your diagnosis. The benefits were still there. I mean, these are, in the oncology world, these are pretty, significant numbers. So it made a huge difference. I think I'm going to skip this slide for the sake of time, but it's illustrating the same point with breast cancer survivors, which is the higher fit group not only survived longer, but they had a lower chance of metastatic disease, just based on their fitness level. Why is that? Nobody really knows, but the theories are that by reducing inflammation and by reducing the amount of bad fat, which we think, for example, fuels some types of breast cancers, you're reducing your chance for metastatic disease. Okay, so we've been talking about exercise. The challenge is figuring out what the right amount of exercise is for everyone here, because I could tell you, most of these studies talked about moderate exercise. So most of these studies said they got moderate exercise, they improved their survival, they had lower fatigue, or whatever outcome they were measuring. The challenge is, what's moderate exercise? Because I could tell you, What's moderate for you and what's moderate for me and what's moderate for Curtis is 3 different things, okay? And what's moderate for you today, after, let's say, having chemo, radiation, surgery, compared to what was moderate for you a year ago or 2 years ago before you're exposed to any of these things, is 2 different things. So I think it's really important to figure out what the right amount of exercises is for each person. Why? And this is a theoretical concern, but I think it's important to articulate it all the same. So we've already spent some time talking about why if you're a couch potato, so if you're inactive, that produces these inflammatory chemicals that we've been talking about. Let me go back. And we think that increases your risk for all these problems that we're talking about. But we're learning that if you get very intense amounts of exercise, that can theoretically suppress your immune system. Okay? And I can tell you the last thing that a cancer survivor wants to do, even if it's theoretical, is suppress your immune system, because your immune system is what is keeping the cancer cells at bay. So the challenge is, again, what's figuring out what's moderate, because it's different for every person. And this slide illustrates the same point, that if you're sedentary, your immune system's not very strong, but if you're doing very, very intense amounts of exercise, your immune system is not very strong. And as an analogy, if you look at people who are training for the marathon, they get more colds, they get more cold infections, they get more flus when they're training for the marathon. If you give someone who's training for the marathon a vaccine, they'll actually get a dampened immune response to that vaccine compared to people who are just getting moderate amounts of exercise. So there is this concern that very, very intense amount of exercise may suppress your immune system to some degree as well. So we need to figure out what this moderate zone is for each person. This is not where you want to be, okay? So at Cedars, we actually have a cancer exercise program where we actually put people through a stress test, and we do some calculations to figure out what that moderate zone is for each person. But there's another simple way that you can, with reasonable accuracy, do this on your own. And one is something they actually use in cardiac rehab. So this is something referred to as a modified Borg. So all this means is you kind of have this sheet of paper in front of you or in front of your elliptical machine or in your mind, and you basically check in with yourself, and you kind of ask yourself, how hard do I feel like I'm working? And if you feel like you're in this severe zone, in terms of your own perception, it's probably too intense. If you feel like you don't feel anything at all, it's probably a little too light. You want to be somewhere in that green zone. And the beauty of this is it's adjustable for each person. So one person could be running 6 miles an hour and feel like they're moderate, and some person could be cycling at a very, very gentle pace and feel like they're in the moderate zone. So it kind of takes into account where you are at any given point in time. Another one I like is something very simple, and we refer to it as the sing-talk test. And it's very easy to understand. All it is if you can sing while you're exercising, it's probably a little too easy. It's probably too light. But if you cannot talk because you're huffing and puffing between words as you're walking or cycling or whatever it is that you're doing, it's probably too intense. So a moderate zone for most people will be somewhere where you can talk, but you cannot sing. And that's a reasonable estimate. And when I came across, I was going through one of the history of medicine talks, and I came across this image, and I didn't know this till too recently, but patients used to do all kinds of things because their doctors told them to do it. Everyone in this room, I imagine, either had surgery or chemotherapy, which you could view as a poison, or radiation, which you can view on some level as being burned. Why did you do it? Because your doctors told you to do it, because it was in your doctor's recommendation. That's really what it comes down to. And so when I think about the resistance that we get to having patients exercise, I couldn't help think about this idea that people will do what their healthcare providers suggest for them. And I think we as physicians don't do a good job because they dismiss everyone in this room. They'll say there's no way you can get people to exercise. If they didn't do it on their own, there's no way you could change their behaviors. And then again, I came across this image from a history of medicine talk, which actually referred to something known as a smoke enema. And that's actually an example of one. So they would give people smoke enemas for cancers, for female diseases, for stomach cramps, headaches, intestinal worms. Why? Because their doctors told them it will help them or will cure them of their disease. Now, personally, I think it would be much easier to exercise than to get a smoke enema. So that's number one. But I think the point is, if you talk to your doctors and talk about what is a safe and reasonable amount of exercise for you, I give you all more credit. I think you would do it if you realized how important it is and if you found a safe level for you. Let me go back. I should mention, and you've probably heard the expression, blowing smoke up your ass is a medical term. This is actually where it came from. It's a good question, I don't know. I'm not going to have time to talk about these things, but I'm not dismissing how important any of these modalities may be for improving fatigue. And it kind of has to be customized for each person, but for some people, acupuncture can be very useful. Yoga can be very useful. I think things like Tai Chi and Qigong for many people can be very useful. Meditation, hypnosis, muscle relaxation. I'm just listing them here. These can all be talks into themselves. If we have a couple minutes, just because I think it's so important, I want to talk about another big problem that contributes to fatigue, which is insomnia. And I already suggested that half of the people going through treatment have insomnia for a variety of reasons. There are plenty of worries that people have. There is pain that can be keeping people up. Hot flashes from hormonal treatments can keep people up. So there are plenty of reasons why people don't sleep. But I just don't think that just Ambien or any sleeping medicine is the answer. I mean, in isolation. There are other things we can try to do besides just sleeping medicines. So what else can you do to try to sleep? And this is just a few concrete examples before we wrap up. The first is going back to something that we talked about, something that we were driven to do, I think, from a biological perspective. Now, I imagine that most of us, I work in a basement, so and I imagine many people are indoors most of the time, especially when they're going through cancer treatment. So when you're indoors, what happens? You don't get any light. And we know that we were created probably in a way where we were exposed to natural light during the day, because most people worked out in the fields and they were outdoors and not sheltered in tall buildings all day long. And then what happened when the sun went down? It was perfectly pitch dark. Edison had not come around, there were no light bulbs, and it was very dark. So there was light during the day and darkness at night. And this is sounding a little more biblical than I intended, but there'll be a reason for this, okay? The reason for this is, that I'm talking about this is, we're learning that because there are so many lights at night and in our bedrooms, I mean, people are sleeping with iPads and computers and cell phones and TVs and all kinds of things on that produce light. And the reason why we think that's a problem is because light shuts down, light at night, shuts down your body's ability to produce melatonin naturally. And melatonin will help most people regulate their own sleep cycle, but it is shut down to a significant extent when you don't get some natural light during the day, and certainly when you don't get darkness at night. So one of the things that we talk about is making sure your room is dark. And another theoretical issue related to this is that melatonin not only helps facilitate sleep, but there's some evidence that it actually has very powerful anti-cancer effects. We know that, and these are medical terms, and I don't want to go over them, but it may help prevent cancer cells from spreading and growing. And we know that it may help our immune system. So one of the strategies I think that we can go to without just going straight to medications is make your bedroom dark. This is something easy that we can all do. Turn off your computers and TVs and cell phones and Facebook, internet, and invest in blackout shades, because there are a lot of street lights that permeate our bedrooms because we live in LA, and that's just a reality of our lifestyles. But you could block out your bedrooms and make your room much darker, and you'll be surprised. I mean, one of the reasons I think some people sleep better when they go to a vacation and stay in a nice hotel is because what do they all have in common? They have really thick blackout shades. Now also you're more relaxed, which is another factor, but I think keeping the room dark is important. We've talked about this, but if you needed another reason to exercise, people who exercise 150 minutes a week or more sleep better. Now, if you can do that exercise, if you have a hard time sleeping, if you can get that exercise in the late afternoon, so between 4 and 7 p.m., that seems to reset the circadian rhythm. It resets your biological clock so you could sleep better. So if you have a hard time sleeping, and if you haven't been exercising, you really might want to consider taking this up in the late afternoon. But you got to stick with it, because 1 week of exercise may not make the difference. In most of these studies, it takes about 4 months of doing this before you benefit from a sleep perspective. I'm going to skip through this for the sake of time, but there are a lot of other strategies that don't require medication to help you asleep. So going back to an image that you saw earlier, and I know I whizzed through these, but there are many, many different factors that contribute to fatigue. And what you may have noticed as I was going through this is there are some areas, some causes shaded in red, and a whole set of other causes shaded in blue. And of course, what's the difference between the two? The answer is the areas in blue are areas that we still have control over. You still have a say in your, and we only talked about really exercise today for the most part, but you still have a say on what you put in your mouth. And all these, the effects of stress and depression and sleep, and going through your medications with your physicians and making sure all these things are optimized. True, there are some things in red, which I'm not dismissing them. They may be the most important ones, the chemotherapy, duh. But I think one of the things we need to do is try to focus on the things that we still have some control over, rather than dwelling on the things that is kind of out of our hands at this point. If all else fails, there are a couple other things that we talk about in our clinic. There's some very small studies looking at American ginseng for fatigue. I always suggest for sure for you to talk to your oncologist before you start a supplement, but in doses up to 2,000 milligrams total per day, this was found to help lessen fatigue for some people. And as you can kind of tell, I'm not one to tend to go to medications first, but when the fatigue is really, really bad and all these other things haven't helped, I think there is a role for some medications, such as these are stimulant medications like methylphenidate, which is known as Ritalin, modafinil, which is known as Provigil, sometimes in certain situations corticosteroids. For appropriately selected patients and under right circumstances, some of these medicines can help. So I think it's important to keep that in mind. So I definitely want to save time for the last piece. I really appreciate all of you coming in and for your attention, and I think we'll take questions at the end is what I'm told. Thank you.
Our last speaker or guest and helpful person is Richard Goodman. Some of you may have worked with him here at Torrance Memorial, where he has a Tai Chi class. and he actually had it just before this program. He also does a program at our cancer support community in Redondo Beach every Tuesday at 1 o'clock. And while he'll dismiss that he's an expert in Tai Chi, he's aware that many of the benefits of Tai Chi people talk about once they engage in Tai Chi. They find it a great means for balancing, certainly physically, but also in terms of our sense of space and where we are. And people find it relaxing for their bodies and their minds. Richard has a very interesting life. He had a lot of careers and a lot of things in life, and he thinks Tai Chi has probably been the most beneficial and simple and profound help that he's ever had. So, Richard.
Yeah, I turned on the mic, but Tai Chi is really nonverbal, so it's very simple. First of all, I'll ask if anyone has any questions or hasn't heard of Tai Chi. It's pretty well known now. And normally what I do is want people to experience it. So it's really very simple, easy form of movement. Moving meditation, often it's referred to as moving yoga. It's also self-defense. And you can do it sitting down, standing up. It's pretty much, most people know it from slow motion type of alternating circular movements. But what I'm going to suggest is if you want to stand up, possibly either in front of, behind your chair, maybe I'll in front of your chair. If you want to sit down, you can do that. I'm going to show you one simple movement. Is just everyone knows how to push and pull, and you can experience Tai Chi. So if you're standing up and you want to step with your right leg, turn your back leg, which is your left, 45 degrees to the corner, and try to be about shoulder width. And step forward with your right foot, any size step you want. So the important thing is that your toe is facing exactly straight. If it's off a little bit, when you go forward, so we're going to just go forward and back with our legs, not our torso or our head. So just back and forth, simple alternating weight. The idea is your knee stops over your toe. If it goes past, you can hurt yourself. And doesn't seem like we're doing very much, but this really, as opposed to just standing, gives a tremendous amount of relief to your heart and your circulatory system. So make sure your toe is facing the way you're facing. If it's a little bit, if your knee isn't over your toe, you could literally hurt yourself. And I'm just going to do one movement. Everyone knows how to push. When you go forward, relax your wrists and pull. Let your hands float down a little bit. We're always drawing circles. So all we're doing is pulling, relax, lower your elbows, hands float down, bend your wrists a little bit, forward. Now you can inhale gently through your nose and exhale gently through your mouth. Imagine you're pulling ink or silk from your fingertips and pushing it out of your palms. We're like drawing a horizontal oval. And inhale. The slower you go now, the deeper we'll breathe. Most of us don't breathe. We gasp. So you're going to try to fill your lungs gently. Sit on your back leg. Exhale gently. Watch the silk. Silk has to be the same speed. If you pull silk from a cocoon, it'll break. Just slow. Drawing circle, pushing it out of your palm, picking it up. Inhale, exhale. So it's pretty rare for us to move with our body, mind, and breath together. And that's why Tai Chi is relaxing. It's called getting centered. Body, mind, breath moving together. And all you need to know is one movement. If you did this, if you could work up to 5 minutes on each leg, it'd be 10 minutes, and do once or twice a day, you wouldn't have to do anything else. So oldest person I've had in the South Bay is 104, and he could stand on one leg, and I'll show you, demonstrate a kick, and simply by going back and forth. And if you're not embarrassed, you could do this. We spend probably 80% of our life waiting, standing in line. You could do this in the grocery store or the bank line. If you don't want to do your arms, just going back and forth it makes an enormous amount of difference. In Chinese medicine, your legs are your roots. If your legs are strong, your body, your immune system. So when you push, we're not going to lock our joints. You don't push too far, even if you were going to push someone. So all your energy in Western medicine, we refer to blood, circulatory system, lymphatic, electrical energy, and a lot of Asian medicine, they have literally dozens of energies. So everything's round, always, never straight or angular. So everything can flow through your body. And just doing this so you can, well, if you do it slow and you can feel it in your legs, let's change legs. So you want to stand about shoulder width and turn your right foot pretty much 45 degrees. Make sure it's not 90, or pretty much to the corner, about shoulder width, and take any size step you want, but try to keep, it's called tracking the distance at least a few inches or shoulder width, back and forth. And soft eyes looking forward will keep your head pretty much straight. You want to be, imagine you're suspended from above, straight line, top of your head, the crown to the bottom of your spine. So back and forth. And if you bring your foot back and it touches your heel, it says, and then you're a little too narrow. So you want to be just a little bit wider, and you can really feel a difference being relaxed. So just back and forth. Most people, their heads, if you talk to people a lot, their heads aren't straight on their body, and most heads weigh, I think, 12 to 15 pounds, which puts geometric pressure on your back. So if your head's straight, soft eyes, looking forward, and just push and pull and inhale and exhale. And you can go any speed you want. Try to go slow. And if you forget when to breathe, it's not that important. Normally, you exhale when you exert and inhale when you come back. Just let your hands float down. You're always drawing like circles. And the slower you go, it's pretty rare for us to fill our lungs and empty them. Again, imagine you're reeling silk, pulling it from your fingertips. You could do this if you're sitting. You could just do it with your hands. You could actually, lots of studies have been done just with your mind, change a lot of your rhythms, but blood pressure, pulse. But if you could just do one movement, even just going back and forth, but even better if you could pull and push and synchronize your breathing. And imagine if you try to keep your toe down when you go back and your heel down when you go forward, and inhale. So you're just doing one movement in the Yang form, which is an ancient classical form that's been passed down for literally hundreds, if not thousands of years. We have like 108 movements. But one movement is all you need to know. Pulling and pushing. You could do it watching TV, just a couple minutes, maybe even 30 seconds. And as the prior doctor was saying, it's really up to you in terms of what's hard, if you need to change legs or rest, because it's not easy just to go back and forth. So if you want to change legs, you want to stand about shoulder width. And if you want to end up with your knees over your toe, determine which leg you want to step with. If you're going to step with your right, turn your left foot. If vice versa, your back foot out. Try to stay shoulder width and not step too narrow or too wide. So just step forward, back and forth. So try it by yourself. If you know one movement and you remember it, you really don't need to do anything else. You could be, as I was saying, this 104-year-old man could balance on one leg and could correct everyone in class, and just because these are your roots. I think the world record, I think, is 72 hours on one leg. And they could switch legs, but you have to do one at a time. So back and forth. So I'm just going to show you one. I'll show you a couple other movements, but it's, sure. Of course, yes. I'm awfully sorry, yeah. Good, yeah. So in Tai Chi, they talk about the I Ching, which is basically 8 directions. So it's either the 4 squares or the 4 corners. So if you're facing straight, you're on the square. So again, let's do it one more time. It's really, the simpler the better. If you want to step with your left leg, turn your right foot 45 degrees. And pretty much most of us know what 45 degrees is. This wouldn't be this to the corner, about shoulder width. Any size step you want, forward and back. And if you're sitting, if you just want to do this, we do diabetic groups here at the hospital that often are missing legs or limbs. And you could still do Tai Chi with one arm or no arms and no legs even. You can move your body. And so this, one of the benefits is alternating the weight. Your front leg's empty and now it's full and your back leg's empty. They call it yin yang. And it's just reeling silk, pulling and pushing. And everyone knows how, and also very powerful. Tai Chi's known for its pushes. You can literally push a sumo wrestler if you're a little off balance, if you push with your whole body. And so we're not just pushing with our hands and then our legs. Again, head straight, not stiff, soft eyes looking forward. Exhale and inhale. Push and pull. And again, you could do this, get up when you're watching television. You could do it standing in the post office or the line. And if you're embarrassed to do your arms, just going back and forth, it's really much healthier than just standing. And then later we'll do more movements where you also get the benefit of twisting. It's called brush knees. So you could circle your right hand by your right ear. Just turn your waist, come on an angle, brush your left knee, push and go forward, and sit back. This is called left brush knee. So you're just circling by your ear, turning your waist. So the other benefit of Tai Chi is the squeezing of your organs by turning your waist and massaging your spine. In Chinese medicine, your spine, go forward and back, is an extension of your brain. So if your spine is flexible, your brain, your body, your way of interacting is flexible. So this is called left brush knee. You're just turning left and right and going forward and sitting back, and just use you don't have to use your shoulder, just elbow, wrist, turn your waist and push and bend your knee forward. Again, you want to try to stand where you finish with both knees over your toe. So you're just turning, and you want to stay relatively straight. You don't want to lean. Just left and right and forward and back. And we'll change legs. So stand shoulder width. If you want to step with your right leg, turn your back leg 45 degrees and just step forward. Again, we could just pull and push. Everyone remembers a pull and a push. And inhale. And exhale. The slower you go, the deeper you can fill your lungs and empty them. So just turn to the left, watch your right hand, circle by your ear. Just turn your waist, come on an angle, brush your right knee, push and bend your knee forward, and sit back. Turn left, circle by your ear, turn right, push in the center and bend your knee forward. Sit back, turn left, circle by your ear, Turn right, brush your knee and push. Bend your knee forward. So this is just doing one movement. Later we could do add movements and we actually move. You can go forward. You could circle your right hand by your right ear, turn your left palm up and sit back. This is called repulse monkey. Turn to the left, watch your right hand, it helps you balance. Circle by your ear. Turn your waist and push and bend your knee forward. Circle by your ear, and pull, push, and sit back. Low, elbows real low, turn to the left. So you're doing very high level of Tai Chi, mind, body, breath moving together, very complicated movements that really take months, if not weeks or years to learn. But we're just doing 2 movements. We go slow so people can follow. And so you could learn the movements. Then we do them, it could be very fast, very small circles. This is just a right brush knee and push with your left hand and bend your knee forward. If you want to do another movement, you could circle by your ear, left palm up, sit back, pull your left hand, push your right, turn. So you're experiencing Tai Chi. So anyone have any questions? Very simple. A lot of people, you can even do it sitting down, like a movement called cloud hands or wave hands like clouds. And it'd be just drawing a circle.
Okay. So I'm going to read the questions. So somebody wrote, I am in my 3rd year of letrozole from Mara. Could you discuss how this drug might enlarge my fatigue? So, it's kind of hard to answer these questions without knowing the big picture, but I could tell you Femara is another example of a hormonal treatment. Some people, for whatever reason, when they go through these hormonal changes, have fatigue. Some people have worsening joint pains with aromatase inhibitors and similar drugs, and the pain can keep people up, and that can cause fatigue. And then also hot flashes, I think we alluded to this, that can keep a lot of people up when you're waking up several times at night. And again, without knowing the whole picture, those would be the first 3 things I would try to focus on in a clinical sense to see if we could help the hot flashes, help the joint pains, and just work around the fatigue because of the hormonal changes that may have occurred.
Okay, good. We had a question here about Dr. Asher's presentation. And we will have it on the website, torranceMemorial.org/S as in Sam, B as in boy, S as in Sam, C like cat, South Bay Survivorship Coalition. The presentation and all of this talk, including your movements probably, if you were in the camera, will be on the website sometime in September.
So the next question was, what can we do for peripheral neuropathy with exercise and medications? So this is something, this is actually a whole talk into itself, but I'll try to give a 60-second answer. There are 2 parts of neuropathy, and I think we often misunderstand this. There are so-called positive symptoms, which means people get the burning, the pins and needles, the tingling, the painful numbness. It's not positive to you. It's positive to the people that wrote the textbook. They're called positive symptoms. Then there's negative symptoms, which means because of the neuropathy, I have poor balance, or I don't have good strength in my feet and ankles. You do not treat the 2 things similarly, because I know the reflex response from most of us physicians is just to give something like Neurontin or Lyrica. It's not going to do anything for the negative symptoms. So there are a number of medications and topical things, and I won't get into all the different things you can do to deal with the pain part of neuropathy. But for the negative symptoms, I think that Tai Chi or Qigong or balance exercises that we do with a therapy program, or anything you can do to improve your balance can be quite helpful. Not because necessarily it undoes the neuropathy, but because it helps you compensate. And ultimately, that's what really counts.
Questions about if omentum was removed around the fat proteins, I guess, abdominal organs, can visceral fat still collect in the abdomen? And the second question is about, does neuropathy stop after chemo?
So regarding visceral fat, I think it. I'm not an expert surgically, but visceral fat, I believe, still can occur if the omentum was removed. The second question was, does neuropathy stop after chemo? With some types of chemo, for example, oxaliplatinum, the cumulative effects of the neuropathy may occur sometime afterwards. And keep in mind, there may be other factors. So for people that are heavy alcohol drinkers, I suggest that you stop, obviously for other reasons, but because that may make neuropathy worse. Diabetes, of course, may make neuropathy worse. But I think there are some chemotherapy regimens where the peak neuropathy effects may not even occur until the weeks after you stop. And in general, so people always wonder when it ends. These nerves supposedly grow back 1 millimeter a day. So you know why they call it peripheral neuropathy? They call it peripheral neuropathy because it's the nerves in the periphery, farthest away from our spinal cord. So the reason you feel it in the tips of your toes and the tips of your fingers is because it's the furthest away from our spinal cord. That's where the nutritional supply to the nerves is poorest, and they get most affected by chemotherapy. These nerves reportedly grow back 1 millimeter a day. So it takes time to see how much recovery can take place. So I would say, as a rule of thumb, I think there's a general sense of plateauing within the first 12 to 24 months, depending on how much chemo you got. But I don't think it's realistic to say chemo ended 2 months ago and I'm going to be stuck with this for the rest of my life. I think you need to give it some more time.
The next question is, how do you exercise when you're extremely fatigued?
So this is not easy, and this is why we did start a cancer exercise program. So the first thing is, your physician really needs to rule out other problems that may be contributing. So the things that medically that may be contributing to the fatigue. But assuming that everything's in order, your thyroids are okay, your electrolytes are okay, they've gone through all your medications and they've optimized everything. And this is really why I think it's important to have a programmatic approach to this, is when the cancer therapist, or when Curtis, or whoever else is waiting for you at a certain time, number one, you're more motivated to show up. And number two, if they're trained in cancer exercise physiology, they really know how to modify the program. So again, it could be very, very moderate to where you are right now. I mean, things can be very, very slow for even yourself a year ago, but it can be a moderate intensity for where you are now. It just takes some skill to figure out what that new happy zone is. And I think if you can find a rehabilitation group locally who can help you with that, that would be very, very helpful.
Okay, the next questions are cytokines influential in chronic fatigue syndrome or fibromyalgia?
I have seen some evidence that it may be linked, and we know that, for example, in fibromyalgia, the brain has a heightened sensitivity of pain. And there are some theories that the hormonal axis and inflammatory pathways may have gone awry. I don't think anyone knows for sure, although they do know for sure that even though it's not a cure, exercise can lessen the effects of fibromyalgia. So I think it may be one possible relationship, but I think fibromyalgia is more complicated because ultimately the brain becomes hyperreactive for reasons that are not well understood.
Also, the next question is, can you test for the genetic predisposition to producing cytokines?
So there's actually a study that is going on through UCLA, and Cedars is a participant of that. It's really research-oriented right now. So until, and this will be years away before, in a clinical sense, people will be checking for these genetic factors. So not yet.
Can chiropractic treatment help with fatigue?
So we didn't even go over precautions today for exercise, but this is when it becomes really important to talk to a physician about safety for exercise. So if someone's platelets are low, and that's what you need for clotting blood, if somebody has bone metastases, so you've had spread of the cancer to the bone, I would not let anyone mess with my spine, number one. Number two, can it help with fatigue? I don't know. I haven't seen any research in that arena. I imagine if one of the reasons you're tired is because you're in pain and some, musculoskeletal back conditions can be improved with chiropractically, I imagine that may improve your fatigue. But I've never seen a study looking at chiropractic specifically for cancer fatigue.
Okay, so the next question is regarding memory. Can memory go back normal again?
Okay. So the question was, can your memory go back to normal? So we're talking about so-called chemo brain type symptoms. And again, that's a whole nother talk. But I'll give you a little preview. So based on the evidence, we think that within 9 months or so, after being done with all your chemo and all radiation and surgery, that most people go back to their baseline in terms of cognitive function. So about 9 months, so that's the good news. The trouble is about 20% of survivors continue to have some of these chemo brain type symptoms for who knows how long, months or years after they're done with everything. And those are the ones that we're really, and we have a chemo brain program at Cedars that we're trying to help those patients trying to maximize their cognitive function. I don't think there's a quick fix with a medication to help with memory, but I do think that exercise, because we know it helps people with memory in general populations, it would be at least something that should be used to try to help possibly chemo brain symptoms.
Okay, the next question, they want to know, what do you say about herbal medicine?
Again, I don't have a sweeping view on it. When I see some reasonable evidence, and again, there are no big trials in this area because there's no money for it, and no one's going to do money for things that you can't support. But occasionally you do see some small studies looking at different supplements for fatigue. To be honest, most of them came up not very helpful. But again, one of the ones I talked about, there are a few others today, was American ginseng, and some small studies was helpful. There are a few other ones. I think the other thing to consider is you want to make sure, even if it's not helpful, that it's not doing harm. And I want to emphasize, there have been several studies looking at supplements that have actually increased cancer recurrence rates or increased the rates of cancer. I mean, very small rates of increase, but this idea that selenium, in one study, or vitamin E for a lung cancer study, automatically can't do any harm, I think needs to be viewed cautiously.
Okay, so next question is asked, what are your thoughts on oversleeping?
I have a 12-month-old, so I don't know what that means. I don't, I think I'm not convinced that the issue is oversleeping, because I wonder if some people may be actually sleeping for 10, 11, 12 hours, but what I imagine is happening is people are spending 10, 12, 14, 16 hours just in bed. And that, I think, is the bigger problem. And one of the things when you talk about sleep hygiene principles and helping people sleep without medications is making sure you're not laying in bed if you're not sleeping. So you only give yourself 20 minutes to fall asleep. If you can't sleep, you get out of bed, you go to the living room, you do something relaxing until you're sleeping, and you try it again. And then when you wake up, you don't just lay around in bed just laying there if you're not sleeping. But actually sleeping 12, 13 hours, I'm not sure, maybe we could talk in person. I'm not sure if that is occurring unless, again, you're on heavy doses of pain medications or other medications that is making you feel that way.
And one last question for you. Do you ever return to normal considering fatigue?
Considering fatigue. So do you ever return to normal considering fatigue? And it's similar to the chemo brain stats I gave. So again, most survivors go back to so-called normal within the first 6 to 12 months after finishing, assuming you can finish all the chemo and radiation. There's a subset that again have continued significant fatigue. And in the study right now that we're doing, there's some evidence that if you've had depression far before your cancer, or if you've had chronic severe stress before your cancer, and this is accumulated, and then you have the cancer and chemotherapy on top of that, there may be something synergistic that may cause the fatigue to last longer. That's the theory that's being tested. But for whatever reason, whether it's these factors or the genetic factors, maybe 20% continue to have levels of fatigue. And can you go back to normal? I think what you really have to focus on is the areas in blue that we talked about. And even if it can't be cured, I do believe strongly that it can be less than probably where it is right now.
Thank you, Doctor. The next question is
So for Richard, how many Tai Chi moves are there in all? In the world?
It really depends how you want to count. There's a lot of different forms, but really there's about 38 different movements or names of movements, because one is called the grass bird's tail, which has a lot of movements, but and they call it the 108 normally referred to look at books in name form. The way, if you don't repeat them the way my teacher counted them, is 188. Again, all you really need to do is do one or two movements. You could even make up your own if you're creative enough. Tai Chi is natural. But the only thing, someone did ask me, I want to insert, if you're interested in Tai Chi classes or trying one, we have 5 here at the hospital. And through Miriam, this program, or Tom, or HealthLinks or Advantage, you can find out what times and where. They're all around the campus here, or again, as Tom said, at the Wellness Center. And I have other classes around El Segundo and San Pedro, et cetera. So, and a lot of other people have classes too. So it's a very gentle exercise. Yoga's good. A lot of yoga classes here.
Well, thank you, Richard, Curtis, Dominic, and Dr. Asher. Thank you very much. Thank you all. You cannot leave this room until you give us your evaluation and pick up a heart while you're at it. Thank you.